I'm Lisa Flood.
And I'm Jason Angelette, and welcome to Faith and Marriage Today.
And we would like to welcome to our show Dr. Brian Credo, a pediatrician in New Orleans. Thank you for joining us, Dr. Credo.
I'm delighted to be here. Thank you so much for having me. Thank you.
Well, Jason and I have been having so much fun talking about how God is really doing something with the medical community. We've done a couple of shows with different physicians talking about the Catholic Medical Association, the profession of medicine, connected to the faith. Let's start with, you're a pediatrician,
yes.
But how have you gotten involved with really encouraging physicians as faithful Catholics?
Well, I think it's very important for young people, especially as they're going through the training to be a nurse, to be a doctor, anything in the medical field, to understand that they're not alone, and to understand that there are many other people of similar faith backgrounds and similar experiences that are there to help them and guide them along the way. So I've been fortunate that I've been able to not only practice clinically, but I teach a good bit at the medical schools, and I've taught medical ethics at Tulane for many years. And it's been a wonderful experience to be able to discuss ethical topics with the students and to give them a perspective they might not have had before. So I think if you are a person who understands their faith, that at least tries on a daily basis to keep getting better at understanding your faith, that you can bring that into the situations where you're helping the students and maybe give them a chance to look at things in the total picture rather than the picture that sometimes, unfortunately, the secular world tries to cordon off for them. So it's important to be encouraging to our young people, especially in the medical fields of nursing, physician, all of these fields. They're very arduous training periods, and so it's important for them to have a chance to understand they're not alone, I suppose.
Yeah. I mean, because that's the thing, I feel like the idea is that, well, keep your faith outside, because that's going to hurt and actually prevent you from being a better nurse or a better doctor. In fact, I feel like it's just the opposite. I feel like our faith truly inspires and helps us to understand better and to grow as a nurse or a doctor. Can you speak about that?
Exactly. So our faith can be a cornerstone for us in terms of building our approach to patient care, in terms of helping people to understand that we don't leave it at the door, because it's an essential part of who we are. And so when we go into that room, we are thinking about the betterment of the other. And to Catholics, that comes rather naturally through our training and our schooling and things along those lines. And when you start to read the scriptures, of course, and start to read the lives of the saints, it becomes just a natural extension of the things that you're learning. The faith goes back to the time of Christ, of course, in terms of healing. Christ himself is known as Christ the healer. But all through the centuries, Catholicism has contributed mightily to the healing of the sick and the helping of the infirm. You think about people like St. Charles Borromeo. St. Charles Borromeo in the 1500s was a bishop in Milan, and there was a great plague that hit the city of Milan. And the secular leaders, the mayor and the governor and people along those lines, they left. They headed out of town. They headed for the hills. Okay, the plague was deadly, and they were afraid of catching it. The bishop stayed. And Charles Borromeo was not just a bishop in terms of staying in the residence, so to speak. He was on the front lines. He was tending to the sick. He was providing thousands of meals a day, arranging for them to be provided. He was at the bedside helping people. You can go back through the centuries, century after century, and see a Catholic influence in healthcare and healing. Why would we not bring that into today's modern world? Why would we jettison that? It would make no sense to jettison that. We should build upon that and be thankful for the legacy of such great people of faith that we have. He was just one, of course. St. Marianne Cope, who was Sister Marianne Cope, she went to the island of Molokai with the lepers. Father Damien sent out a call to other religious orders to help him on the island of Molokai. Not many responded, but St. Marianne did, Sister Marianne did. And she bravely said, "I'm not afraid, I'm coming to help the people." And for years and years, she tended to the lepers with Father Damien. She never caught leprosy, by the way. Died of old age a good bit later. But there are tremendous examples in the Catholic faith of people who have gone the extra mile to help those who are ill. So we should embrace that. We shouldn't run from it.
Well, this is the opposite of what society would tell us today, right?
Perhaps so, yes.
You know, society would say, well, the two are mutually exclusive, your faith and medicine. For you as a physician, for you as a Catholic, was there a moment where you said, okay, I've got to be bold and start speaking about how I can be a strong Catholic and an incredible physician at the same time.
Sure. I think we think of the adage of St. Francis, I believe, preach the gospel always when necessary, use words.
Yes.
So I think the main thing with regard to my journey, and with regard, not just me, but many Catholic physicians in the city, you try to lead by example a little bit. You try to make sure that in your clinic, you only do those things which you feel are considered proper for the patient. And you don't bow to the society that tells you should do this, this, this. The patient wants this, do it. The patient wants that, do it. We're not functionaries and, trying to just work in a store or something like that. All work is wonderful, but doctors have a special responsibility and a special role to do what is really for the betterment of the other. So there have been times when I've had to say, I won't participate in that, I won't participate in that. And that example was noted by those around me, and that's a nice feeling when people understand that and say, well, that's pretty cool, that works out pretty good. But it does require a little bit of wherewithal to do that, because the academy, so to speak, is not always the most friendly place to Catholics. And so we would like to get the word out there that there are a number of people, especially in our city, which is so Catholic, that can help in these regards and can kind of help steer the ship towards a way that's most beneficial for everyone, especially for the patient. That's really who we're there for. We should be about the patient, not about ourselves. So that's the most important thing.
Right, because that's what it's happening, is that we don't let go of our faith, because our faith is inspiring us, and that there's something that's beautiful that our faith is inviting us into. But then to see that, like, we can't bow to the pressures, but it's also important to be together in community with this, and we don't fight this battle alone. Can you speak about that?
It is. So when you feel that you have the communal aspect in your corner, so to speak, it becomes much easier for you to live the faith in a more practical manner on an everyday basis. And there are a lot of strong Catholics. The city of New Orleans is so steeped in the history of the Catholic response to illness. People don't realize Charity Hospital, you go back to 1736 when Charity first started, there was a collection taken up at St. Louis Cathedral for the indigent patients at Charity Hospital when it was first beginning. Charity itself began as an act of compassion. Jean-Louis was a boat builder in the city of New Orleans, and the timber was plentiful, and boats were the main conveyance of the day, shipbuilder. So he had many employees, and they kept getting sick. And Charity was not the first hospital. People get that confused. There was a Royal Hospital in Louisiana before Charity, but you could only go there if you were a soldier of the king.
Oh, wow.
Or if you were connected. So Charity became the first hospital for the people. So upon his death, he left an inheritance, so to speak, of a certain amount of money to establish the hospital. So it began in compassion. And like I said, the Catholic community rallied to that and supported the hospital through years after years. What we think of as Big Charity, which is the hospital down on Tulane Avenue, which is now shuttered, but that's the sixth incarnation of Charity Hospital. But all along the way, the people who were at the backbone of healthcare in Louisiana, many of them were Catholic shining lights. You think of the stories of Sister Stanislaus. I'll just say quickly, Sister Stanislaus was the nun who basically ran Charity Hospital for many decades during the Huey Long and during the early 1900s era. And she was orphaned when she was a child and went to the Daughters of Charity, who raised her, and she became a young novice. And then her first assignment was to go to Charity Hospital. She was from the West originally. But she stayed there for 60 years. Wow. And she was known for these incredible acts of compassion to the patients. There was a ward of older ladies, and she would go into that ward every day, and there was she called them her girls. And there was a Roman candy man with the truck selling candy, and the mule, not the truck, but the mule carriage coming down the street on Tulane Avenue. And she would put coins in a basket and lower it out the window. And the man would come over, take the coins, load the basket with candy, and she would pull it back up, and she would go to the ladies and okay, girls, who needs a treat? Who needs a treat? And she would hand out candy. She had a special spot for the children at Charity Hospital. If you were a young boy about to go get a tonsillectomy, you would come back from your tonsillectomy unable to, speak or anything really, but under your pillow you would find a baseball that just miraculously got there. Or for a young lady, she might find a set of combs or brushes or whatever the nuns could find to give a special gift to the children. She was a marvel of a person. And when she died, her funeral was so well attended, thousands of people lining outside of St. Joseph Church on Tulane Avenue and then going through the streets of the city to her burial place. any politician in the world would have envied having that many people at their funeral. She was the rock star, so to speak, of her time. She died in 1949, but an incredible person. So that's our history in Louisiana. The Catholic Church and healing in Louisiana go hand in hand, and we want to see that go long into the future.
Well, the story that you just told is incredible. I had never heard of Sister Stanislaus. So
really
you're telling
incredible.
us things that we should know, and we're happy to know now.
Sure.
But you've mentioned a few times, Dr. Credo, since we've sat down with you, the word compassion. When you're talking about being a physician and being compassionate, what are you trying to encourage others to do?
Well, I think it gets back to the definition of another word, and I think that is often misunderstood today, and that's success. And let me explain what I mean. In the secular world today, success is sometimes geared by how much money you make,
Sure.
or how much status you have, or how much power you control over other people. And that's really a poor definition of success. I could name you many people who've had a lot of money in history who you would not want your children to grow up and emulate. Success is not exactly measured in terms of power or money. Success is determined by how much you're able to give of your heart for the other. And if you really think of the word compassion, we think of it as people who are conscious of the suffering of others and who want to accompany them in that suffering. So for a Catholic, when we talk about the Passion, we talk about our Lord on his way to his death. Compassion, you're walking with our Lord on the way to his death. That's not an easy thing to do. But when you do it, you reap innumerable graces, and you can give that wonderful sense of purpose to others. So really, it's kind of like the difference between sympathy and empathy. Many people might be sympathetic if you lose a loved one or something like that, and they might say, sorry about that, and go up on their way. But empathy is something much different. That's walking with the person and kind of being with them and being there the next week and the next week and the next week. The long journey. The long journey. And so for us, compassion should come naturally from our Catholic faith.
What's been the response of other physicians or nurses, healthcare professionals in general, to know there is a community in the Catholic Medical Association to walk together in the faith?
I think it's it's been a very warm response from the people that I've spoken to. Dr. Angela Parisi and Dr. Sherry Longo have been my two friends who have really been at the forefront of making sure the Catholic Medical Association becomes reinvigorated, so to speak, and that more activities are on the horizon. So I think that there are many, many nurses and occupational therapists, respiratory therapists. I don't want to limit it just to doctors by any means, but many people in healthcare who are gratified to see that there are people living their faith and also doing their best for the patient. They are not mutually exclusive things. In fact, they complement each other beautifully. So I think it's been a warm response, and I'm excited. From what I understand, their first talk in July, when they had Father Mons, who's wonderful, speak about redemptive suffering, they had a good crowd, and I think from the early indications for this talk, it looks like there's a lot of people who are interested. So we're going to be very excited for that night.
Yeah, I'm blown away because I think it's so beautiful because you're bringing out not only the importance of coming together as a community of faith to support one another, but we also have this beautiful, rich history of like our faith in action, like you said with the sister Stanislaus. It's like that's what Christ compels us to do. Like it's not just like clocking in, clocking out. It's not just about doing the basics. It's about going beyond in that presence. Like you said, compassion means to suffer with somebody, and that's what our faith is inspiring us to do. Tell from your experience. I don't know, just tell us more, like what that looks like in reality, like in walking, encouraging other physicians, nurses to take on this responsibility.
I think Samuel Taylor Coleridge once said that he is the wisest physician who is the greatest inspirer of hope. So if you're going to go into the medical field, you have to be an inspirer of hope. You have to be able to look at a situation which can look rather grim and try to find a way to bring something better out of it and try to encourage people along the way. So to me, those have been the nicest times in my career when I've had a chance to really be with a family when a child is going through a serious illness, or when I've had a chance to be with with a student who I'm teaching, a medical student or something, who is having something happening in their life that's interrupting their ability to, maybe learn as well in medical school things, and to try to be with them and to try to change the situation so that it'll work out for their betterment. So those are kind of the things that I think of the most. We took care of so many people at Charity. My residency was at Charity Hospital and Children's Hospital. In pediatrics, we did a month at one hospital and a month at the other. So we would go back and forth. And there are so many stories of just bravery and hope, and the bravery of parents, too. I think that doesn't often get as much credit as it should. I mean, to me, parents are heroes. Parents take on the role of, someone once said, it's an incredible thing being a parent. It's to see your heart go walking around outside your body. And in a sense, that's really what it is.
Yes.
That's what it is. Your children become so much of your existence, and you want to do the best for them. But we forget sometimes about the importance of relating to parents well, and pediatricians have to always remember that, because the parents are suffering too. You're treating the child, but the parents are really the ones who understand on an adult level what's going on, and you have to be very sensitive to their needs and very understanding of explaining things properly and making sure they're getting all the resources. Also, another thing I'd say about compassion is that a good doctor always welcomes a second opinion or help or things like that. I was taught in medical school that if a patient asks for a second opinion, you say bravo. I'm glad, because you always want your colleagues. Your colleague might have a different perspective than you. Just like next week on his case, you might have a different perspective than him. So good doctors are always willing to work together, and we need to have that in medicine. We need to have doctors who check their egos, not their faith, but check their egos at the door, and have enough humility about them to want the betterment of the other. And many doctors are very good at doing that. Some could do a little better, as we all could sometimes, but that's an essential thing. I think the compassion is the word humility, and that's not a word that gets a lot of press these days. In American society, humility is not something we talk about a lot.
Well, isn't the field itself is very competitive, right? I mean, I'm thinking about your med students, right, who are like, I mean, they have been on the top tier probably their whole career in grade school, high school, in college, and now like this is competition. But to have a humble heart in the face of this competitive field, I guess maybe my question is that I'm maybe thinking of people, let's say, who are studying or thinking about becoming a doctor or nurse, about just that encouragement to step in that space, to have that compassionate heart, but also maybe another question is that what are you seeing from your students of any kind of fears or worries that they have entering into that field?
I think I teach a lot of freshmen in medical ethics, so when they're first starting off, their main fears are, can I handle the material? The material is voluminous, and there's a lot to learn and a lot that you're going to be quizzed on with great consequences to the result of your passing. So they're worried about that, but they're also worried about, where will I fit in? Will I be able to fit in as a person of faith? Will I be able to fit in terms of holding to my own moral core? And we try to encourage them and let them know that yes, not only is that something you should do, that's a requirement. You should not leave the best parts of who you are at the door. That's going to be for the betterment of your patient. But when you do that, just do it in a sense of understanding the humility of the situation.
So this leads me to some upcoming events that you've got that you're really inviting med students, nursing students, occupational therapy students, all across, dental students.
We are.
Let's talk about the event the Catholic Medical Association is sponsoring in October.
Thank you. So on October 22nd, which I believe is a Wednesday night, we're going to have a talk. I'm going to be the speaker. I'm very humbled by that. But we're going to talk about this entire issue, creating compassion in medicine - a Catholic perspective. So we're going to talk about compassion in medicine and the nuts and bolts of how people in the medical field can go about enhancing their ability to walk the long walk with their patients. And very much it will focus on some of our wonderful role models in Catholicism, some of our, of course, our scriptures and things along those lines. But it's going to give them a chance to really kind of hone their skills to become better Catholics in that regard. And it's just such an important thing to let them understand that they're not alone, that they definitely have compatriots in this regard. The one, I tell a story to the students sometimes and they giggle, but it's true that in the 1500s in Spain, there was this huge castle, and the castles of the day were where the monastic orders lived, but also where the scholars would come. They were like the pre-runners of universities, and the scholars would come and talk, and they would discuss the great scientific movements of the day. And there was this humble man who was the doorman in the castle, and his job was to clean the bathrooms and to open the door and to check on the dinner and to do the basic work of the castle. And but when a knock would come at the door, he would run to the door and say, "I'm coming, Lord. I'm coming, Lord. I'm coming." And the great thinkers at the tables would scoff at him and would say, "He thinks he's going to see Jesus at the door. What's wrong with him?" You know, they would kind of make fun of him and scoff at him. But he was determined that whoever was on the other side of the door,
Yes.
a poor person begging for food or a fabulously wealthy scholar seeking entrance, he was going to greet them as though they were Christ.
Yes.
Today, the poor doorman has been raised to the canon of the saints. That's the story of St. Alphonsus Rodriguez.
Wow.
The scoffers at the tables, no one remembers their names.
Wow.
But it's just something to think about. We have to respect learning. We have to
Yes.
be grateful for learning and for knowledge, but we have to use the knowledge wisely for the betterment of the others, not for our own aggrandizement or whatever that word would be.
If someone wants to attend the event, do they have to register in advance?
I believe there's information that Jason,
post that?
Dr. Angela had spoke with you about that's going to be posted on the
Okay.
site. Tell me a little bit about what she did.
So what we're going to do is on our YouTube channel,
Okay.
we'll have in the show notes descriptions of this event that's coming up, and there's also to sign up and more information about that. But also, there's another event.
There's another event, the
Right.
White Coat Mass. I know
Yes.
that's in November. We'll
Okay.
post that as well. But can you tell us a little bit about
Sure,
what that
sure.
event is?
The White Mass is a wonderful event, and I've helped out with that in the past here in New Orleans. That's at the cathedral. Archbishop Ammon himself celebrates the White Mass. It's a Mass designed especially for those in the healthcare field, and the readings reflect Christ the Healer. The entire mood of the church, the entire ambiance is geared towards those people who want to show Christ to others in this. People who are walking in sickness. And then afterwards there'll be a small reception afterwards right outside the cathedral, and that's a beautiful event. It brings together people in healthcare from all across the city, and that's going to be in November, and that's a wonderful thing. It's similar to the Red Mass. I don't know if you
for
remember that.
lawyers.
For
Yeah.
lawyers,
Yeah,
right,
yeah.
exactly. Both my older brothers are lawyers, so I know about the Red Mass a lot.
Yeah.
But it's similar to that. The Red Mass, St. Thomas More, kind of the inspiration behind the Red Mass for lawyers. Well, we think of the White Mass as being St. Luke. St. Luke was a physician,
That's right.
one of the
Yeah.
gospel writers. And we have many Catholic saints who were physicians. St. Joseph Moscati comes to mind. There were many.
Yeah.
But it kind of takes on that feeling, and it's a wonderful event. So if you're in healthcare in the city and you can make that Catholic White Mass, that's a wonderful thing. Yes.
Praise God.
Yes.
We've seen
Amen.
pictures of that in
Have
the
you?
past. I think we showed in our last show.
Oh.
I don't know. I think I shared with you before we started that I'm close to some med students, some dental students, and some nursing students all in my life.
Yes.
And I'm watching them wrestle with everything you're talking about. Like, how am I going to live all this out?
Right.
And how am I going to be who God created me to be as a Catholic first, but then as a nurse, as a physician? And they're kind of concerned.
No, it's not easy. And you have to kind of always keep your bearings. Don't let the minuscule events of the day prey too much upon you, but you have to know what you stand for.
Yes.
You have to know what as a Catholic is important to you, and you have to live by that. And there are ways to do it, but there's a definite undercurrent of anxiety sometimes among the students in training. So my advice would be to come to an event like this and to seek out those in our community who have gone through that before somewhat, and who can kind of steer you in the right direction and kind of help you, sometimes back you up and be there for you if you need certain things to kind of happen. There's a great Catholic community here, and they have to know they're not alone. There's no easy answer to the question of what they can do, because it's part of the secular world and there's a lot of moving parts. So there's no quick, easy answer. Just like compassion in the talk, we're going to talk about habits of being, but I can't tell you to mix 3 ounces of this with 2 ounces of this and drink and you'll be compassionate. I wish I could. If I develop that, I'll win the Nobel Prize, but I haven't developed that yet. But there are are things that you can do, things you can understand and come to incorporate into your practice style. And generally, most people have a way of coming through it pretty well.
You know, we're coming close to our time, but you do a lot of amazing things in the Archdiocese for the church and the medical community. But you're also working with high school students. Is that correct?
I am.
Could you tell us a little bit about that?
Sure. I teach a course in biomedicine at Rummel, which is my alma mater. So they asked me a few years ago when I was coming to Career Day, you know, Dr. Credo, the boys kind of like your little talk, and have you ever thought about teaching? And God has a sense of humor, because I had thought about teaching. So I said, okay, well, I'm at the stage in my career where I can step back a little from the clinic and go into a little bit more of the teaching. And so I did, and it's been the most marvelous experience. The boys are energetic and bright, and they keep you interested in all the daily things going on. And so that's been wonderful. Also, not just at Rummel, but we've used it to kind of expand to other schools. For example, in the spring, we do a mock medical school match day with Rummel and girls' schools, Dominican High School, Chappelle High School, and we'll bring the boys there, and the boys will take, and the girls will take on the persona of a med student on match day. And they'll have to pretend that they're matching in orthopedic surgery in Chicago. And the other person has to ask questions and guess what their specialty is and where they're going. And so it's kind of like a fun little mock experience for them, but they learn all about the specialties, they learn about how many years are required. And it's a great experience, so we're expanding that into other high schools. Ms. Koenig at Dominican and Ms. Rowley at Chappelle, they've been wonderful with that. So it's nice. I enjoy working with high school students. They're the healthcare providers of the future.
Well, yeah, exactly. And so, like, what do you see some breakthroughs for them, some like eye openers for them in those settings?
Sure. To me, it's been wonderful because the pre-professional program at Rummel with the medicine and the law and engineering, I've had boys who I taught 3 or 4 years ago now come back to me and say, you know, Dr. Credo, I'm an ENT now, and I've thought about that in your class. Or, Dr. Credo, I'm in medical school now. I just graduated from Loyola last year, and now I'm in medical school, and you got me thinking. So that's very gratifying. It wasn't me. It was just the chance of them being in the class and using their own talents. And if God used me in a tiny, infinitesimal way, that's wonderful. But those are gratifying things for a teacher. Teachers touch the future, you know. So it's a wonderful thing. I've really enjoyed that sojourn into the teaching world. It's been nice.
Dr. Credo, thank you so much for joining us. Our time went so quickly. That's all the time we have. Thank you so much for being with us. To all of our healthcare professionals, if you would like to learn more about the upcoming event hosted by the Catholic Medical Association or to register, please go to our Faith and Marriage YouTube channel and look in the description of this episode.
And that's our show for today. Thank you so much for watching. Until next time, God bless.